Now, the developed world is rapidly aging, with adults over the age of 65 years old outnumbering children under 5 for the first time ever as of last year. And as today marks the Day of Elderlies here in South Korea, we thought we'd take a look at how the country's senior healthcare system is handling the rapid pace of aging in this country. Lee Kyung-eun tells us more.
With aging populations booming worldwide, so is the demand for doctors specialized in treating elderly people, otherwise known as geriatricians. As the number of geriatricians in a country is likely to determine its future public health, many OECD countries have formally recognized the crucial role geriatricians play. For instance, the UK and the majority of EU nations accredit geriatrics as a professional medical field that requires up to 8 years of training. However, in the U.S., geriatrics is classified as a subspecialty. It is part of the primary care specialty group, with physicians from internal medicine or family medicine taking 1 or 2 years of fellowship to be certified as geriatricians. A number of Asian countries like Singapore, Taiwan, and Japan have similar systems to certify added geriatric qualifications. But in South Korea, one of the world's fastest aging countries, geriatrics is not formally recognized by the government. Instead, the role is filled by doctors from other departments like internal medicine. However, many experts say geriatricians play a unique role in the medical world. At the fundamental level, they differ from other doctors in that they treat the normal symptoms of aging as a type of disease. Their ultimate goal is not treating organs to return them to their original state, but instead preserving as many functions as possible to promote healthy aging. They also treat chronic diseases in a way that's different from how younger patients are treated.
Treating older patients requires unique forms of treatment and a special approach, as they are physically weaker and more fragile than younger people, and as such, they require more advanced treatments.
With growing demand for geriatricians in South Korea, medical societies have been trying years to make coordinated efforts to officially implement geriatrics in the country's healthcare system, but there are multiple barriers.
The major problem is clashing interests among different medical societies, which in turn have their own separate agendas. Some groups even oppose the whole idea of it because they view geriatrics as a threat to their own medical departments. Also, insufficient education programs and low income are hindering medical students from pursuing the field.
With these limitations, the future of geriatrics in South Korea looks uncertain for the time being. But experts say the raising awareness of the issue will help the country shift toward carefully considering the needs of the nation's senior citizens. Lee Kyung-eun, Arirang News.